My name is Isa Fairley, and I'm the president of the tenacious Theta Theta Chapter of Delta Sigma Theta Sorority Incorporated. Did you know Black pregnant women and their babies tend to receive low quality care? If this happens to you, learn from our health experts about positive birth outcomes.
There are so many different things that naturally that we can do to make sure we prepare for the birth, whether that's walking, seeing a chiropractor, believe it or not, getting your hip and your pelvic in order. You know, if you think about pushing out between a 6 to even 9 pound baby, you definitely want your back and your pelvic to be aligned and to be prepared to expand, right? So I tell those mothers those different things that they can do to prepare. You know,
I personally think that women would benefit from having home visits at certain points after their pregnancy, after they deliver. For example, when I was 19, I gave birth to a son, and I actually had a nurse come and visit me. I think it was like a week after my pregnancy. And I think that they should have check-in points like a week and maybe 4 weeks, so that if they have any questions, things that may arise, or they could pick up on sometimes even subtle cues that can direct them to have the patient follow up with the healthcare provider. Particularly in Ohio, we have First Year Cleveland. First Year Cleveland was developed to kind of circumvent some of these issues and improve birth outcomes. And that also comes with, we have more nurses who go out and they will visit women who are pregnant for the first time and deliver their first child. And they follow them up to, I believe it is the 2nd year of life for that child. And that helps to prevent some of the poor outcomes that can happen as it relates to both the mom and the baby. But I think that should be available to all women, no matter if it's your first baby or sometimes even your 5th, because a mom who has a 5th baby, she is at more risk for postpartum hemorrhage.
Also starting conversations around what safe sleep looks like, how breastfeeding is very, very healthy and protective against things like SIDS or crib death. So just really leaning into the things that we know works. There's programs that increase the likelihood of a person having a full-term pregnancy, like centering pregnancy, which is group prenatal care. And so for folks who are in group prenatal care, there's no difference between how white women and white babies do versus how Black women and Black babies do. So programs that work, we have to lean into, we have to put some policy behind them, we have to put some money behind them, legislation, we got to get insurance companies on board so that we really do support things that work.
Making sure that women have access to maternal infant health programs because they are able to come to them in that postpartum period and help them, or postpartum doula, giving them resources to help them with breastfeeding, and just arming them with the things that may be necessary after delivery is definitely one way that I try to support my patients, as well as just making sure that I support them during their delivery and that initial postpartum period that I have them with me.